Welcome back to the channel. In this video, I'm going to share my 3 main takeaways from the book, The End of Alzheimer's by Dr. Bredesen. So I recently read this book through for the first time, even though I was familiar with the concepts, but I recently read it all the way through for the first time, and stay tuned for a longer summary coming soon. But in this short video, I'll just share 3 major takeaways from the book. All right, so number 1 is blood sugar and insulin is a major thing to focus on. So one of the main underlying causes of Alzheimer's is problems with blood sugar and insulin. It's not the only cause, but it's probably, if there was just one thing that you were going to focus on, it would be getting your blood sugar and your insulin figured out, which means if you have prediabetes or type 2 diabetes, you'd be getting that reversed, getting that fixed. Or if you have any sort of high blood sugar or other risk for that, then you would get that figured out. And that would require some lifestyle changes, such as eating better, exercising, and something that can help a lot is doing some fasting, which I often talk about on this channel, of course. And those things could help you reverse diabetes or could help you prevent diabetes depending on your situation. So that's takeaway number 1 is getting your blood sugar and your insulin figured out is going to have a huge impact on lowering your risk of Alzheimer's, or if you're already starting to get Alzheimer's, putting you in a better position to potentially reduce those symptoms or reverse those symptoms. So major takeaway number 2 from the book, The End of Alzheimer's, is you want to combat certain types of inflammation or avoid certain types of inflammation that can be a major contributor to Alzheimer's. So a couple that he harps on a lot in the book are leaky gut. Leaky gut, often one cause is gluten, and there are others that he mentions. And then another thing would be conventional dairy, which is inflammatory, has certain inflammatory proteins and other things in it. So if you're just drinking the standard old cow milk off the shelf and other things like that. So you might want to consider some dietary changes to reduce sources of inflammation such as those. All right, so major takeaway number 3 from The End of Alzheimer's is that there's a bunch of other steps, and it involves things like balancing your hormones and a lot of other nuanced medical tests that you would want to go through the process if you're someone who's at high risk. So in other words, some of the other things that he talks about have to do with hormones. Some of them have to do with certain supplements you might need if you're low on certain minerals and things like that. And some of them are different, like if you have lead or mercury toxicity or whatever. So there's a whole series of medical tests and potential medical treatments that are relevant. But if you do the first 2 things that I mentioned, if you focus on those, you probably see a benefit or lower your risk quite a bit. But that if you're someone who's at high risk or already getting the symptoms, you probably want to get the book or the sequel called The End of Alzheimer's Program and walk through all of those steps. So there's a lot more to the book. Obviously, it's a pretty long book, but those are my 3 big takeaways from The End of Alzheimer's book, which is the first program to prevent or reverse Alzheimer's. It's a big step in terms of changing our paradigm about Alzheimer's. Stay tuned for a longer summary. I'm going to share a very detailed summary of the book in the coming days or weeks here, sometime fairly soon, if you want to really dive into the details. In the meantime, if you want to learn more about how to prevent or treat Alzheimer's using things like fasting and a ketogenic diet, then check out my video here where I talk about KetoFlex 12-3, which is one of the main cornerstones of Dr. Bredesen's program for preventing or reversing Alzheimer's. Thanks for watching. I'll see you next time on FastingWell.